I'm Dr. Mel Hauser. I use she, they pronouns, and I'm Executive Director here at All Brains Belong. At All Brains Belong, we believe that connection is the path to health. And one of the cornerstones of our model is our group medical visit program, where we bring groups of patients together who are navigating similar health journeys, where in addition to anything that we would do in a typical visit, there is the opportunity to spend more time with your clinician, and two, be able to connect with community and learn not just from us as clinicians, but from one another. Members of our staff and our community advisory board have created a mock group medical appointment so you can get a sense for what you might expect. Hi, everybody. Welcome to our group medical visit. I'll just introduce myself and invite anyone else who would like to introduce themselves as well. Mel, she, they.
Hi, Lizzie, she, her.
David, he,
Sarah,
him.
she, they. Sorry, David.
That's okay.
Hi, I'm Amy, she, they.
Sarah, they, them.
Thank you so much for being here, and thanks to everyone who filled out your pre-visit planning form. We collect information ahead of time asynchronously before the appointment. We call this pre-visit planning. And the purpose of this is to gather your individual health information and priorities for the visit so that we can make sure that the group appointment meets your individual needs. And it lowers the pressure so that we don't need to be asking you direct questions in front of other people because you have shared a lot of information ahead of time. Because of what you've shared, I have a good sense for what your priorities and concerns are to pay attention to today. And I'm just going to share screen and orient us to our community agreement. All right. So all forms of participation are okay here. If I'm billing your health insurance for today's visit, I do need to see you to confirm that you are you, but then you're welcome to have your video on or off. Even if it's on though, we don't expect anything of you. You certainly don't need to look at the camera. You can feel free to move, stim, fidget, eat, take breaks, whatever you need. And you're welcome to communicate in any way that you're most comfortable. You can unmute and use mouth words. You can type in the chat box. Since this is a group medical appointment, we of course balance individual versus collective access needs. And so making space for everyone to participate in the way that they're most comfortable. And of course, honoring confidentiality and as in the agreement that you signed prior to this group medical appointment. Cover all kinds of topics from ADHD to mast cell activation, dysautonomia, hypermobility, like all kinds of, and we have both weekly different people each time, and it's just a one and done, but we also have recurrent groups of small groups that it's the same people every time, so you have the opportunity to have like a more familiar feeling space and get to know people and have optional peer support between visits.
One of the things that I don't quite know how to capture that in this, there's this kind of camaraderie that develops during the course of a medical visit when you have more time together. And I just and I don't quite know how to capture that sort of the supportive nature of the kind of the me too, and oh, that's a good question, and oh, that's the and oh, and maybe even just me saying that is something.
So Lizzie and I will be keeping an eye on the chat. So the little speech bubble icon, that's the chat box, and feel free to use it. You can also send private chat messages to directly to me.
I have a question.
Yeah.
I didn't want the group to know my question came from me. There is a way that I can message you directly so that you could read my question anonymously.
Exactly. So if anybody sends a private chat message, I won't read your name out when I'm reading it out loud. The next part of the group medical appointment is educational content about the topic. What we're going to be doing today, we're going to have an introduction to the neuroimmune cluster that many neurodivergent people experience. We'll answer your questions and we'll do some medication management. So all the things, that's what we call this cluster of neuroimmune conditions, because mostly all the people here have all the things. when we think about how there's a pattern of related medical conditions that often go undiagnosed for decades, and they're all interrelated. They're all related to the nervous system and the immune system and the way that those two systems communicate with one another. So this is a way of understanding how these different components of this cluster can connect and overlap. And today this is an overview group medical visit, but we have group medical visits, of course, on each of these subtopics. And then we also have even smaller group medical visits where you're matched with patients who are going through very, very similar health journeys. All right, I will keep going. So the thing is, these conditions are all related. And unfortunately, sometimes some of the standard medical management from some parts of this cluster make the other parts worse. So for example, if you have floppy connective tissue, such as in hypermobile Ehlers-Danlos syndrome, and someone gives you a muscle relaxant because you also have chronic pain. Well, if you also had a sleep disorder like obstructive sleep apnea and your airway is collapsing, well, that muscle relaxant might make it worse.
So I was thinking about all the things, and I recently started with a CPAP machine for sleep apnea, and made me think about that when you were relating to taking a sleep muscle relaxant. And I think it's like when I started the CPAP, my nervous system started getting really activated. So I was wondering if that could be related like to different systems, but when they're interacting from one treatment, that would interfere with, say, another part of my body.
Sure. I mean, so I think that whenever there is a change, the autonomic nervous system, which is in charge of all your automatic functions like heart rate, blood pressure, body temperature, all of that, I think that it's going to react. There's a question in the chat. Sarah's wondering, Amy, did you have a sleep study?
Yeah, I had a sleep study. The doctor wanted me to do it in the office sleep study, but the insurance only covered for a home visit. So I did a sleep study at home, but that was conclusive enough to diagnose with sleep apnea.
Yeah. And so Sarah's wondering about a referral to a sleep medicine doctor. Absolutely. We can do anything during a group medical appointment that we can do in an individual visit. So, we can make referrals, we can order tests, we can prescribe medicines and supplements, we can give you individualized advice. Other questions?
How do you tell if something is like, how do you tell what the threshold is for like, this is a, like, how do you tell what the threshold is for this is like MCAS or some other co-occurring condition, or if it's just like a one-time reaction?
Yeah, I think what we're looking for is a pattern to make a formal diagnosis of mast cell activation syndrome. We're looking for symptoms in 2 or more organ systems. We're looking for symptoms that get better with mast cell targeted treatments. And to make a formal MCAS diagnosis, we're also looking for blood tests or urine tests that show some of the chemical signals that the mast cells release. But even in the absence of those tests being positive, people still do often benefit from medicines and supplements targeted at the mast cells. We just don't call it MCAS if those tests are not positive.
Cool, thank you. That was a really helpful clarification.
These are examples of what is in this cluster. This is not an exhaustive list at all.
Mel, I missed
Yeah.
something. What's MCAS?
Oh, thanks. So mast cell activation syndrome. Mast cells are a type of immune cell They're monitoring the environment, and when they encounter something that is a threat, they react. And so many neurodivergent people have mast cells that either are reacting to things that are not threats, or like in the example of, when I'm driving and there's a bumpy road, the vibration is not actually a threat to my immune system, but my mast cells think it is. Or maybe it is a threat, like a bee sting is a threat, but has a huge response. So it's one thing to react with, a slightly itchy, hot arm after a bee sting in the arm. It is excessive to go into anaphylaxis. So it's mast cells are reacting to things that are either not typical threats or reacting in excessive ways. And mast cells communicate with the nervous system and the soft tissue, and mast cells end up being like the go-between of multiple organ systems. And so learning how to manage and regulate one's mast cells is an important part of medical management. In the chat, Lizzie's asking, can my migraine be related to all the things? Yes, it can. That is a common part of this neuroimmune cluster. There's a comment in the chat, someone saying that they think they have all of these components of all the things. Sarah.
Yeah, I was just thinking me too.
This is meant as an introduction, and it's about like peeling away the layers of the onion to figure out whether the health conditions that you've been struggling with are part of this neuroimmune cluster. For many people, there may also be some lab tests that would be helpful, looking at different kinds of immune markers and checking vitamin levels. But for some people, that's not what they're looking for. And I think it's about developing a really individualized approach to get you the information that you need to try to improve your quality of life. This is the point of the visit where people might each get their own turn going through their individual next steps, whether that be medication changes or supplements or referrals or tests or any number of things. And then we wrap up.
The brilliance for me of the group medical visits is the sort of like informational part. And then when the questions start coming in and what gets pulled out of you as a physician is so dynamic. And so I love the different sections of that. But I do think that because it's, Sarah's initiation around asking the questions like on the chat and kind of pulling that out of you, I do think that because you don't watch yourself during a group medical visit, I think you'll see what we're all witness to in terms of uncovering how that starts layering for ourselves. How we start pulling on like, oh, wait, I have that. And we start making connections for ourselves based on examples you're giving. Yeah.
Well, thank you all so much.
So there you have it. That's the gist of a group medical appointment. And so if you've not tried one before, consider discussing this with your clinician at your next individual appointment. What we've seen so far is that group medical appointments are part of reimagined healthcare, and in particular, reimagining healthcare as community, belonging to a group of people who comes to value and be valued by one another.